For the record, my name is Joan Koerber-Walker. I am employed by the Arizona Bioindustry Association as its president and CEO, and I am a resident of Arizona. All right, so I am one of over 365,000 Arizonans who are working on science and technology right now, and specifically focused on improving health. So, as we look at, what that means, obviously we want to have a better quality of life. We want to have an important, healthy way of living. But we also have to recognize, as one of the largest employer sectors in the state, it also has a huge economic impact. And so that these numbers just show you how the health innovation community is growing here in Arizona. Now let's get to the fun stuff, because we want to talk about what's actually being created in Arizona, what's being delivered in Arizona, and what's coming. That's what the chairman wants to hear about. So I want to start off with a story. So 40 years ago, there was a doctor at the University of Arizona Cancer Center. And he was a pathologist. His job was to look at cancer slides and do a diagnosis that way. And there was nothing more agonizing for a patient than waiting. And so he was working late because another patient was waiting. So he pulled out a yellow pad, and you actually see a piece of that yellow pad there, and he thought about how he could design a new thing to automate pathology. 40 years later, the company that became, which is still in Oro Valley, Arizona, treated 40 million cancer patients just in 2024. That is what it takes to truly create a health innovation that impacts people. So, of all the people you're going to see today, this one's my favorite. That's my dad. My dad contracted hepatitis when I was a teenager because the sewer backed up on a New Year's Eve and he had cracks in his hands when he cleaned up the mess. It damaged his heart and he should have died. But thanks to healthcare professionals and a company based here in Arizona that manufactures defibrillators and other medical appliances that kept him alive for 30 years, okay, he got to see his children grow up, his grandchildren grow up, his great-grandchildren be born, and celebrate with them. And when he was dying, he took my hand and he said, I want you to thank the people in Arizona for giving me 30 extra years. So when we look at the new health innovations that have come over that period of time, we now see that over 75% of the electronics that go into medical devices that are used all over the world are made in Tempe, Arizona. We have engineers in Tempe, we have engineers in northern Arizona, and we have engineers in southern Arizona all working on cardiac devices that are designed to either keep the human heart functioning, improve the quality of life for those patients, and in one case, there is a company in southern Arizona that makes the only total artificial heart approved in the United States, Europe, and Canada. And in that case, if you are waiting for a transplant, which heart transplants are very difficult to get, if your heart is failing, you get sicker and sicker, and then you fall off the transplant list. With this company and this technology that has been developed over 25 years and is delivered from Tucson, Arizona, they literally take out the diseased human heart, replace it with a mechanical artificial heart. The patient gets healthier. When a heart is available, a human heart can then be transplanted into that patient. So those are some of the things that are happening right here in Arizona right now. So how did we really jumpstart this? You probably recognize Governor Hall. Jane D. Hall was the first governor to focus on the bioscience cluster here in Arizona. But what really catalyzed things was Prop 301 in 2000, because that created TRIF, the Technology Research Initiative Fund, which has put the researchers and the research capacity at our 3 state universities. And just to give you a feel for that scale, size and scope, over $1.8 billion of TRIF funds. Remember, that's money that's coming from the sales taxes that you and I all pay, has gone into research at the universities that's driving this research innovation forward. So it's estimated that almost $200 million will be available through those designated funds under TRIF as part of that Prop 301, and then later legislative funding is going to be going into research in Arizona this year to create new treatments, cures, discoveries, et cetera. So this is a test. Can you tell me who in that picture is living with a challenging and potentially life-threatening chronic disease? Can you tell?
The short one.
No, it's not the short one. It's the tallest one. So that is actually my oldest son, who was diagnosed at the age of 19 with Crohn's disease. And the reality is that, and a large number of other chronic diseases, many of the autoimmune diseases, we don't even know what causes them yet. We know what the symptoms are, we know how to treat the symptoms, we don't know the cause. So one of the things that's really exciting is right now in Arizona, we have new research institutes that are being born in downtown Phoenix under the auspices of the universities that are specifically going to be focused on those diseases that we don't have answers for yet. Because if we don't know what causes it, it's very hard to cure it. And so when we think about, the population of the United States, okay, almost half of the U.S. population has at least one chronic disease. When we talk about the cost of healthcare in the United States, that starts to explain or help us understand why our healthcare costs are constantly rising to a level that is crippling state, local, and federal governments. And so, when we talk about, where these diseases come from, what causes these diseases, many of them are lifestyle related, but not all of them. So in that case, the gentleman that has that chronic disease was a nationally ranked athlete, eating the best diet you could possibly have. He had at the time less than 3% body fat, okay, but he still got that disease, right? So when we talk about chronic disease, we have to keep in mind that chronic disease comes in all shapes and sizes. And just when we see someone, we don't necessarily know what that cause is, and until we know the cause, we can't come up with the cure. So somebody told me you can always succeed if you have pictures of children and puppies. So we had children in the last picture, we have the puppy in this one. So in 2025, unfortunately, 42,000 Arizona residents, according to the American Cancer Society, will be diagnosed with cancer. And it's anticipated that 14,000 Arizona residents will lose their lives to cancer. So here in Arizona, whether it is diagnostics to provide early detection so that we can catch cancer early when it's most treatable, to radiology and other devices that are being used to diagnose once the patient does have a diagnosis of cancer and tracking, to new diagnostic tests that are being done by companies, several of which have spun out from the Translational Genomics Research Institute over time. Those are impacting the lives of Arizona patients. In addition, the legislature several years ago passed biomarker legislation, which makes Arizona one of the leading states in the country for allowing patients to get access to these life-saving diagnostics tests. Okay, this was a tricky one because I promised to give you pictures of real people doing real things. And obesity is probably one of the biggest challenges. Okay, yes, that is me. And yes, I am clinically obese. I have a BMI of 30. Now, when we talk about obesity, okay, it is a spectrum. It is not one individual thing. But it is one of our largest health challenges right now because when I was a little girl in 1964, it was cool to smoke. Everybody did it. We now have more people in the United States on a percentage basis that are clinically obese than smoked in 1964. And when you look at the various, what we call comorbidities, things that can be complicated by from being overweight to being obese to stage 2 to stage 3 obesity, stage 3 obesity is where you have now serious, very serious health challenges. Those are drivers because whether we're looking at metabolic disease, things like diabetes, whether we're talking about structural diseases like arthritis and problems with joints and the musculoskeletal system, whether we're talking about heart disease, all of those things are affected in some way or another by what we weigh. Now, there are other health factors, but these are big ones. So, and my guess is at some point in the Q&A, there may be a question on some of the drugs that are being used to treat that right now. But, when we look at what's coming, we've had surgical interventions for decades now. We have had health behavioral innovations and interventions, which, by the way, as we saw with smoking and tobacco, it takes a very long time to change behaviors of a full population. And now we do have both nutraceutical as well as pharmaceutical interventions that are being utilized by some patients. But the reality is that the focus on obesity in the United States now is going to start, we're going to start seeing the same kind of effort and focus on that we saw when Surgeon General Koop started talking about tobacco in the 70s. Good news. Arizona is 14th by population. As you know, it ranks 9th in the nation for clinical trials. Clinical trials have an economic impact, but more importantly, it gives Arizonans the ability to get access to life-changing medicines that are being developed from companies both here and outside of Arizona sooner. Now, in this case, you see one of the leading experts of phase 0 clinical trials in the world for glioblastoma. And that is a disease where patients can't wait. It moves too fast. And so a phase 0 clinical trial that's happening here in Arizona would allow a patient to actually be dosed with a medicine and tested just on them, not waiting to see what happens to everybody else, but what will work for that patient at that time when time is at a premium. Okay, another topic which I'm sure this committee will be looking at in depth is AI. Okay, I tell my companies, please do not put .ai after your company name unless you're actually using it. Personally, as someone who's been in the technology industry now, this is my 5th decade of working in technology, both in semiconductors and then in computers and now in the life sciences. I don't like the term artificial intelligence. It's very confusing and it's very misleading. But what we can do today with machines relative to pattern recognition, relative to large data set management and large data set queries is going to change the face of healthcare. Will these machines ever replace a doctor? Will they think on their own? Definitely not in my lifetime. But what we are seeing is that these large language models, these large data set models, and these large imaging models are already making a difference in drug development, where we are looking at hundreds of thousands of potential compounds. In diagnostics, so, back when doctors were looking at slides, I almost slipped, when doctors were looking at slides and figuring out, if you had a disease just by looking at it and eyeballing it, now these computers are able to look at these images, we've gone beyond slides, and see, these very, very small variations that can then help a doctor diagnose where they need to go next in the patient's treatment path. We're also seeing AI being used today to improve the patient experience and the physician experience. There's a company in Scottsdale who has developed a language model that helps do the triage with the patient when they come in to present, so that when a doctor actually is seen by the patient, or gets to see the patient, they already have some ideas of what they need to talk about. And then lastly, to wrap things up, the Arizona Health Innovation Trust Fund was developed, including with some of the people in this room. It is designed to be a perpetual trust that will fund innovation going forward in the future here in Arizona for health innovation, as well as developing the workforce we need to grow and helping the entrepreneurs get those companies ready so that they can develop patient treatments and cures. And with that, Madam Chair, I'd be happy to answer any questions you might have.
All right, members, any questions? Representative Fink.
You were talking about, like that single person. Is that like an N of one type of study, or how is that?
Ms. Walker?
Madam Chair? Okay, so Representative Fink, with the Phase 0 clinical trials, it is still within the normal clinical trials process, but it is very close to an N of 1 type of a scenario. So they may have a drug that is being used in another indication. There may be a drug or a procedure that's being utilized but has not gone through the clinical trials process, but that patient may not respond under the normal clinical trials scenario. And so what they're doing is they'll do like microdosing and then move the dosage up in the clinical trial to the point where they get clinical benefit, or very quickly realize that there is no clinical benefit and go to the next opportunity for that patient.
Madam Chair?
Please.
Just because of my field, is there any of this health innovation in regards to nutrition, various, other types of, functional and integrative type of medicine?
Ms. Walker?
Yes, there is. So basically, a lot of work has been done here looking at the metabolites that we exhale when we exercise, when we eat, when we do those things. And for people that have either health challenges or are trying to become more healthy, there are technologies in development in that area. But the other thing that I think is really important is where some of these new communication technologies will allow us to reach new populations to help with the education and that behavior modification and that changing in thinking. Because as you know, relative to nutrition, the most important thing we can do is to help our body heal itself by giving it the best resources and the best fuel. That answer your question?
Other questions? Representative Conway.
Madam Chair, distinguished guests, thank you for being here. I'm just wondering what your biggest hurdles are. I mean, like I'm thinking of the first thing we need to tackle and take on as you move into the next 10 years. What do you see?
Ms. Walker?
Madam Chair, so as I look out to the future, access is going to continue to be a challenge. If you have access to insurance, if you have access to resources, if you're in a community where those resources are easy for you to get to, you're blessed. If you live in a rural community where the pharmacist may be the only medical professional in town, if you don't have access, you fall outside the social safety net, so you're not, your income level is too high to access the social safety net programs, but your income is too low for you to live and pay for insurance, which is becoming a larger and larger problem for our middle class. Some of these things may be out of reach for you. And so I think that will be a challenge. And then the other challenge, and Dr. Hipa and I talked about this the other day, my generation is our biggest challenge. So I am the end of the baby boom. And so there are more of us that need care than there are in Gen Y to pay for it, or Gen X to pay for it. Gen Y actually is bigger than baby boom at this point, so that will dig us out of that hole. But we do have about a 25-year gap where the cost of delivering health care is going to be a problem. And so what I see in that future is not just that we come up with the treatments and cures that are making life better for people, but we also have to come up with systems that allow us to lower the cost of health care by preventing disease before it gets out of hand, by working with our healthcare providers to make sure that they have the technologies that allow them to work more efficiently. Because the other thing that's really scary is my generation is a preponderance of the doctors, and so we're going to run out of doctors before we run out of people. And so having doctors accessible to patients is going to be a challenge. Managing the cost of healthcare, one of the reasons, and Representative Schweiker in Congress and I have spent a lot of time talking about the importance of new technologies that can lower the overall cost of healthcare and how do we utilize them and integrate them into the system. But yeah, basically, technology can do wonderful things. Technology doesn't help anybody if you can't get it. So that will be our biggest challenge, I think, in the next decade.
Thank you.
Thank you, Madam Chairman. Not that you gave us the darkest timeline there, but obviously it's a little scary, right? Like, so give us a thing or two that you think is a reason for optimism in this front over the next decade. It can be anything you want, but give me the other side.
So,
Please.
Representative Wilmoth, when we look at cancer, for instance, remember I showed you the picture of the man and the dog? So there is a company here in Arizona that is currently working on a multivariant cancer diagnostic that can be diagnosed from a drop of blood using neoantigen technology, which is basically identifying when the body has identified a cancer as a foreign agent, we'll put it that way. If we can catch cancer early, we can treat it earlier. It saves us money and it saves lives. They are working with dogs right now. The dog test is most likely going to be on the market this year. Now, why would we do dogs before we do people? Two reasons. It is faster to get it through the USDA than it is to get it through the FDA with dogs. But also from a scientific perspective, dog cancers grow about 5 times faster than people cancers. And so we can test them more effectively. But the bright spot is there could be a time in the not-so-distant future when Arizona will be home to a leading multi-cancer diagnostic that is cost-effective, not just in the United States, but around the world, and that would be saving lives and lowering our healthcare costs, and more grandparents and great-grandparents would get to see their great-grandchildren.
Members, any other questions? And offline, I'd like to talk to you about the GBM research, the new one. That's kind of touches home for me, so.
So we actually have the Arizona Bioscience Caucus.
Okay.
The next caucus is going to be meeting on the 18th of this month in the the Copper Room downstairs, and we're going to be talking about research. And the opening video, we always start the caucus with a video. The opening video is a researcher working on GBM. If you want, I can send it to you in advance.
I would love that. Thank you so much.
Any other questions?
I see none. Thank you so much for coming. I really appreciate it.
Thank you for the opportunity. Thank you all for your service.